Bill Gates is one of the World Health Organization's top donors, pouring billions into this organization. While he's called for virus war games every 5 years, Canada's top bureaucrats just locked us into this captured organization's radical new rules to make sure that happens. The United States rejected this exact power grab last year, but Canada didn't even think twice, and now they've signed all of us up without even asking. Let's dig in.
Nations who accept the new regulations are signing over their power in health emergencies to an unelected international organization that could order lockdowns, travel restrictions, or any other measures it sees fit. In fact, it doesn't even need to declare an emergency. Potential public health risks are enough for it to initiate action.
While the United States is outright rejecting the pharmaceutical interest captured World Health Organization, here in Canada, our government just does what the globalists say. Earlier this month, Governor General Mary Simon authorized the Minister of Foreign Affairs, Anita Anand, to take the actions necessary to accept, on behalf of Canada, the amendments to the international health regulations that were adopted in Geneva, Switzerland on June 1st, 2024. This quiet release was done without parliamentary debate. There was no public consultation, just this order in council, cabinet making more decisions while Canadians are being left in the dark. This is sneaky, it's incremental, and it has sweeping implications.
If we're going to give the WHO that much power, we should at least invite a thorough public debate, especially since the agreement is an official treaty and it bypasses the U.S. Senate, which plays a key role in ensuring major international commitments receive proper democratic oversight. To make matters worse, the new regulations employ extremely broad language that gives the WHO unprecedented power. They require countries to establish systems of risk communication so that the WHO can implement unified public messaging globally. That opens the door to the kind of narrative management and propaganda and censorship that we saw during the COVID pandemic. We don't want to see that kind of system institutionalized even further.
I've been reporting on this for years now. In May of 2024, these amendments were rushed through in Geneva at the annual World Health Assembly. That's the decision-making body of the World Health Organization. It was done without a vote, but just some loosely defined quorum. I warned you then that this wasn't about health security, but rather it's about handing unelected bureaucrats at the WHO, which is led by Director General Tedros Ghebreyesus and their pharmaceutical profiteering partners like Bill Gates and his foundation, more power to declare emergencies, direct responses, and pressure countries into compliance. And here we are with Canada just formally accepting them. In a now removed report, Tedros praised China's effort early on in the pandemic and praised China's response to the outbreak.
I will praise China again and again because its actions actually helped in reducing the spread of coronavirus to other countries.
He not only praised China's COVID response, but he pushed the safe and effective narrative and now says these changes are just about cooperation and collaboration, like it's no big deal. Sure, tell that to the countries rejecting them outright, like the US, under Trump's leadership, said no, and they pulled out completely earlier this year, funding and all. Others are hesitating, but not Canada. We're all in, as per usual. Do you remember my earlier reports? Health Canada was scrambling on transparency and talking points, hiding data and accusing the public of misinformation while their own house is a mess. And virus profiteer Bill Gates, who is now the largest funder of the WHO, wants to see military-style virus war games every 5 years so he can grade countries on their response plans.
We need to be doing every 5 years a really comprehensive exercise at both country and regional level of pandemic preparedness. And you need a global group that's kind of scoring everybody and saying, hey, you know, if you're not participating in this, you could be the source of the next pandemic. And that's bad for the entire world. This is like a fire that goes global.
We've seen how all of this plays out. Emergency powers expand, dissident gets labeled misinformation, and suddenly recommendations from the WHO become the status quo. Mask mandates, lockdowns, and travel restrictions, and hey, even vaccine passports. If you question it, they're coming for you. Tedros even admitted it.
The serious challenge that's posed by anti-vaxxers. And I think we need to strategize to really push back, because vaccines work, vaccines affect adults, and we have science, evidence on our side. I think it's time to be more aggressive in pushing back on anti-vaxxers.
The IHR amendments grease the wheels for exactly this: faster declarations, more coordination with global actors, less room for Canada to say, thanks, but no thanks. Parliament hasn't even debated this, and provinces, they're barely consulted. Yet the government even confirms these military-style virus war games right there in the text. The page proudly lists emergency preparedness and response exercises as a core way Canada meets IHR obligations. This new framework outright calls for recurring simulation war game exercises, and they're not necessarily optional feel-good drills either. They're baked in as part of this regular cycle of global health security preparedness. The page normalizes them without addressing concerns about top-down scenario planning that could shape policy and erode local response discretion. The IHR reinforces and secures more of the same playbook that we saw during COVID, emergency after emergency with little accountability. Health Canada and the Public Health Agency of Canada love to talk about global health security, but who guards our security from global overreach? Who protects informed consent when the next pandemic or declared emergency rolls around and Tedros or his successors point the finger?
We need legislation to enshrine this withdrawal from the World Health Organization so the next president can't just slam us back in. Someone has to have enforcement power that everybody agrees we are going to stop gain of function research.
We've been here before. Families torn apart by mandates, jobs lost, trust shattered, and now they're locking in the framework for the next round. Be aware and stay diligent and informed. For Rebel News, I'm Tamara Ugolini. Canada said yes to more WHO influence quietly without your knowledge, and the mainstream media is silent completely on this topic, but it demands sunlight. So share this, demand debate, demand transparency from your MP, because if we don't push back now, the next health crisis won't be managed from Ottawa. It'll be directed to you from Geneva. Sign our petition and follow our reports on this topic at nopandemictreaty.com. That's nopandemictreaty.com.